one of the big things that we as physicians do when somebody presents for hip pain is we try to really define where that hip pain is and how the patient experiences it, because pain around the hip can come from a lot of different locations. For example, most classically, pain that is coming from the inside of the hip joint itself, so that might be a labral tear or arthritis, would be deep-seated anterior, almost groin-like pain. Whereas pain that's on the outside of the hip is usually something else entirely.
These problems can be an inflamed bursa on the side of the hip or inflamed tendons on the side of the hip that balance your hip. These tendons are kind of like the rotator cuff of the hip. They support your pelvis, they work when you walk. If they get inflamed or even break down or tear, they can cause hip pain.
Or other times people will come in talking about hip pain and really they mean pain kind of in the back, in their buttock area. And many times that can be related to the sciatic nerve or issues with their low back or something going on with their pelvis. And so a big part of what I do in the office when somebody presents with a complaint of hip pain is trying to better define which of those various things might really be at play and then trying to figure out how best to treat that.